Sodium bicarbonate works in the body as a buffering agent, meaning its primary role is to help regulate acidity, not to alter structure, organs, or anatomy. The human body is extremely precise about pH balance, especially in the blood. Normal blood pH stays within a very tight range, and even small deviations are corrected rapidly by the lungs, kidneys, and buffering systems. When sodium bicarbonate is introduced, it does not suddenly alkalize the body in a dramatic or lasting way. Instead, it temporarily increases the availability of bicarbonate ions, which can neutralize excess acid for a short period of time. This is why sodium bicarbonate has legitimate medical and athletic uses. In clinical settings, it may be used to manage certain acid-base imbalances under supervision. In sports science, it has been studied for short-term performance benefits during high-intensity exercise. When muscles work hard, they produce acidic byproducts that contribute to fatigue and a burning sensation. By buffering this acidity, bicarbonate can delay fatigue slightly, allowing muscles to perform a bit longer or feel stronger in the moment. This effect is temporary and functional, not structural. Circulation is often misunderstood in this context. Sodium bicarbonate does not directly open blood vessels or increase vascular size. However, when fatigue is reduced and metabolic stress is slightly lower, the body may perform more efficiently. In some individuals, this can translate into better short-term circulation during physical exertion or arousal. Improved circulation can enhance firmness or fullness in tissues that rely on blood flow. That change can be noticeable, but it reflects better use of existing tissue, not growth of new tissue. Blood pH is also frequently misrepresented online. Drinking or consuming bicarbonate does not meaningfully change blood pH in healthy individuals. The kidneys quickly excrete excess bicarbonate, and the lungs adjust carbon dioxide levels to maintain balance. Any shift that does occur is mild and brief. The body actively resists large pH changes because they are dangerous. This is why claims about alkalizing the blood to increase size are biologically inaccurate. Short-term performance effects can influence perception. When circulation improves even slightly, tissues that depend on blood engorgement can appear larger or feel firmer. This is a functional change, similar to how hydration, reduced stress, or better cardiovascular fitness can improve performance. Perception plays a powerful role here. When something feels stronger or more responsive, the brain often interprets that as an increase in size, even though the underlying anatomy has not changed. Anatomy is fixed by tissue composition, connective structures, and genetics. Sodium bicarbonate does not interact with these elements. It does not stimulate cell growth, lengthen tissue, or permanently expand blood vessels. Its effects remain biochemical and short-lived, focused on acid buffering and metabolic efficiency. Understanding this distinction matters because it separates science from hype. Sodium bicarbonate can influence how the body performs under certain conditions, but it does not rewrite anatomy. Any noticeable change is temporary, circulation-related, and dependent on overall health factors such as hydration, cardiovascular function, and nervous system balance. Recognizing what bicarbonate actually does protects people from false expectations and from misusing a substance that was never designed to change physical size. One of the most important concepts to understand when people talk about size changes is the difference between permanent structural size and temporary functional changes caused by blood flow. These two are often confused, especially in online discussions, but biologically they are completely different processes. Permanent size is determined by anatomy, the length and composition of tissues, the attachment points of ligaments, and genetic development that occurs primarily during puberty. Once adulthood is reached, these structural factors remain stable. They do not fluctuate from day to day, and they cannot be altered by foods, supplements, powders, or quick techniques. Temporary changes, on the other hand, are driven almost entirely by circulation. Certain tissues in the body are designed to expand when blood fills them. When blood flow increases, those tissues become fuller, firmer, and more responsive. This is a functional state, not a structural one. It is similar to how a muscle looks larger during a workout because it is engorged with blood, yet returns to its baseline size afterward. The tissue has not grown, it is simply being used at its full capacity in that moment. Firmness plays a major role in perceived size. A fuller, firmer state can create the impression of increased length or girth, even though the actual dimensions have not changed. This is why factors such as hydration, relaxation, arousal, and cardiovascular health can all influence how size appears at different times. When circulation is optimal, tissues expand completely. When circulation is reduced due to stress, fatigue, anxiety, or poor vascular health, the same tissue may not fully expand, leading to a smaller appearance. The anatomy remains the same in both cases, only the level of blood flow changes. Momentary swelling is also part of this process. Increased blood volume in the tissue causes mild, temporary expansion. This swelling is reversible and disappears when blood flow returns to baseline. It does not involve new tissue formation, cell growth, or lasting changes in structure. Once the blood drains, the tissue returns to its original resting state. This is why any substance or practice that claims to increase size instantly is almost always influencing blood flow or nerve response, not anatomy. Permanent growth would require structural remodeling of tissue, something that the adult body does not do in response to circulation changes. Growth involves cellular proliferation, changes in connective tissue, and long-term hormonal signaling. These processes do not occur from temporary increases in blood flow. Without structural change, there is no true enlargement, only improved function. Understanding this distinction helps set realistic expectations. Improving blood flow can improve performance, firmness, and confidence. It can help someone experience their full natural potential rather than a reduced version caused by poor circulation or stress, but it cannot push the body beyond its anatomical limits. When people report size gains, they are almost always describing a shift from a suboptimal state to a fully engaged one. Recognizing the difference between structure and function is essential for separating science from illusion. Temporary changes are real, noticeable, and meaningful for performance, but they are not permanent. Structural size remains constant, while blood-driven changes come and go based on health, arousal, and circulation. Understanding this protects people from misleading claims and helps them focus on what truly improves sexual health and confidence. Erection quality is fundamentally a vascular and neurological process, not a chemical trick or an acid-alkaline shortcut. At the center of this process is nitric oxide, a naturally produced signaling molecule that plays a critical role in blood vessel function. When arousal begins, nerves release nitric oxide into the smooth muscle of blood vessel walls. This signal tells the muscles to relax, allowing blood vessels to widen and blood to flow more freely into erectile tissue. The result is firmness, expansion, and stability. Without adequate nitric oxide signaling, even healthy anatomy cannot reach full firmness. Blood vessels themselves must be flexible and responsive for this process to work properly. Healthy vessels expand easily, delivering blood efficiently and maintaining pressure. When vessels are stiff, inflamed, or narrowed due to poor cardiovascular health, stress, smoking, lack of exercise, or chronic illness, blood flow becomes limited. This directly affects erection quality regardless of size or anatomy. That is why erectile quality is often an early indicator of overall vascular health. Hydration plays a surprisingly important role in this system. Blood volume and circulation depend on adequate fluid levels. When the body is dehydrated, blood becomes more concentrated and circulation efficiency drops. This can reduce firmness and endurance. Proper hydration supports smoother blood flow, better pressure regulation, and more consistent vascular response. Again, this affects performance and fullness, not structural size. Alkaline hacks are often misunderstood because they confuse systemic chemistry with localized physiological function. The body tightly regulates blood pH through the lungs and kidneys. In healthy individuals, blood pH does not fluctuate meaningfully based on diet or supplements. When someone consumes an alkaline substance, the body quickly compensates to maintain balance. There is no sustained shift in blood pH that could enhance nitric oxide production or permanently improve blood vessel behavior. What sometimes happens is indirect and temporary. If a substance reduces stomach discomfort, placebo-driven relaxation, or exercise-related fatigue, the nervous system may become more relaxed. Reduced stress can improve nitric oxide signaling because anxiety and tension constrict blood vessels. In this case, the perceived benefit comes from nervous system calm, not chemical alkalinity. The mind and vascular system are closely linked, which is why belief and expectation can temporarily influence performance. Nitric oxide production itself depends on factors such as physical activity, sleep quality, oxygen availability, and overall metabolic health. Regular exercise improves endothelial function, the ability of blood vessel lining to produce nitric oxide efficiently. Diets rich in natural nitrates from vegetables, adequate protein for amino acid availability, and reduced inflammation all support this pathway. None of these mechanisms involve altering blood pH beyond its normal range. Alkaline myths persist because they offer a simple explanation for a complex system. The reality is that erection quality reflects the integrated health of nerves, blood vessels, hormones, hydration, and psychological state. No single substance can override these systems. When people report improvement after using an alkaline product, it is usually due to improved circulation from relaxation, hydration, or short-term metabolic effects, not a true biochemical shift in the blood. Understanding this science shifts focus away from hacks and toward fundamentals. Supporting nitric oxide naturally, protecting blood vessel health, staying hydrated, managing stress, and maintaining cardiovascular fitness are what truly improve erection quality. The body does not respond to shortcuts, but it responds consistently to physiological care and balance. When it comes to substances promoted online for quick results, safety is often the first thing sacrificed for attention. Sodium bicarbonate is a clear example of how a common household product can be misunderstood and misused when stripped of medical context. While it does have legitimate uses, those uses are specific, controlled, and limited. Outside of those boundaries, the risks begin to outweigh any perceived benefit. One of the primary safety concerns with sodium bicarbonate is its sodium content. Regular or excessive intake can significantly increase sodium levels in the body, which places stress on the cardiovascular system. This can lead to fluid retention, elevated blood pressure, and increased workload on the heart. For individuals with undiagnosed hypertension, kidney issues, or heart conditions, this risk is not theoretical. It is real and potentially serious. The digestive system is another common site of adverse effects. Sodium bicarbonate can irritate the stomach lining, cause bloating, nausea, gas, and in some cases, vomiting or abdominal pain. When mixed improperly or taken in excess, it can produce carbon dioxide rapidly in the stomach, leading to discomfort and, in rare cases, gastric rupture. These are medical events, not harmless side effects. Electrolyte imbalance is another overlooked issue. The body relies on a precise balance of sodium, potassium, and other electrolytes to maintain nerve function, muscle contraction, and heart rhythm. Excess bicarbonate can disrupt this balance, leading to symptoms such as muscle cramps, weakness, dizziness, confusion, or irregular heartbeat. These effects may begin subtly but can escalate quickly with repeated misuse. There is also the risk of masking underlying health problems. When someone uses a substance to chase temporary improvements in performance or firmness, they may ignore early warning signs of vascular disease, hormonal imbalance, or psychological stress. Erectile quality is often an early indicator of overall health. Covering it with quick fixes delays proper evaluation and treatment, allowing more serious conditions to progress unnoticed. Viral claims thrive because they are simple, dramatic, and emotionally appealing. They offer certainty where biology offers nuance. However, popularity does not equal proof. Anecdotes are not evidence, and repetition does not turn speculation into science. Medical evidence requires controlled studies, consistent results, and biological plausibility. Sodium bicarbonate has not demonstrated any ability to permanently change size or anatomy in credible research. Evidence matters because it protects people from harm. Science is not about denying hope, it is about setting realistic expectations and preventing unnecessary risk. When advice is based on evidence, it can be adjusted for individual health, monitored for side effects, and weighed against benefits. Viral advice offers none of these safeguards. Limits exist for a reason. The body is not designed to be manipulated through shortcuts, especially with substances that alter internal chemistry. Even substances considered safe in small, appropriate doses can become harmful when misused or taken for the wrong reasons. The absence of immediate harm does not mean long-term safety. Understanding safety and limits shifts the focus from chasing myths to protecting health. Real improvement comes from approaches that respect physiology, cardiovascular fitness, stress management, proper medical guidance, and evidence-based care. Myths promise fast results, but evidence preserves long-term well-being. Choosing science over viral claims is not just smarter, it is safer.